ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello, welcome, and thanks for tuning in to the European Centre for Disease Prevention and Control audio series, ECDC On Air. I'm your host Lee, recording from our headquarters in Stockholm, Sweden. This past year through the pandemic, you might have heard of ECDC being mentioned here and there, but you may be unfamiliar with what actually goes on here in Stockholm when we're not talking about the COVID-19 pandemic. As an EU agency, ECDC aims to strengthen Europe's defences against infectious diseases. We cover a wide range of subjects including surveillance, preparedness, epidemic intelligence and response measures. We provide scientific advice, give public health training, and raise awareness through our disease programs. Put simply, we do quite a lot.
On today's episode, we're speaking with Dr Piotr Kramarz, Deputy Chief Scientist here at ECDC. We discuss the importance of vaccines, a little bit about their history, the role ECDC plays when it comes to vaccine monitoring and scheduling in Europe, and how vaccines can help fight not only COVID-19, but also other diseases. We encourage everyone who is offered the vaccine for COVID-19 to take it, but also to remember the importance of getting vaccines for other vaccine-preventable diseases. So we're here today with Dr. Piotr Kramarz, who is the Deputy Chief Scientist here at ECDC. Piotr, welcome. Thank you for joining us. To begin with, how long have you been here at ECDC and what brought you here originally?
I've been here for 14 years now, but it feels like I joined yesterday. The work is so exciting and there's so much to do that the time passes very fast. I'm a physician by training and I worked in clinical settings, but at some point I transitioned to epidemiology and I worked in the Center for Disease Control in Atlanta in the US. And when I learned that there is a European CDC, then I wanted to apply and work here. So it's kind of like a continuation.
Okay. And as the Deputy Chief Scientist here, what are your primary responsibilities?
So as the Deputy Chief Scientist, I support the Chief Scientist, Professor Mike Catchpole, primarily in ensuring the high quality of the scientific outputs that are produced by ECDC. But I have a few hats and I'm also a Deputy Head of Unit in the Unit of Disease Programs. And during COVID time, I'm part of a group of so-called emergency managers. So like on Thursday, I will start my next 2 weeks duty as the COVID emergency manager.
Okay, well, today we're going to be talking a little bit about vaccines. And to begin with, I want to just quickly go through a history of vaccines, which are quite interesting. So the first vaccine that we really sort of think of is how cowpox was used to inoculate against smallpox. In more modern times, what are vaccines and how do they work?
Vaccines are basically a way to train our immune system to fight infections. And they do it by introducing to the organism a killed virus or bacterium or a weakened virus or a protein of the virus to train the immune system to recognize it and to mount a response. It's a bit like a self-defense training where people can practice in controlled environment how to defend themselves. And then when the real threat comes, hopefully it doesn't come, but if it comes, they are ready. So that's a bit of what happens with the immune system that is trained. The immune system has memory and vaccines can help immune system to build this memory and then be ready when the real threat comes.
Okay, so just a little bit on the COVID vaccines that have recently been released or in the past year. A couple of these are mRNA vaccines. What is the difference between these types of vaccines and the vaccines that were developed for things like measles or polio or other diseases?
Well, I would like first to maybe start with what is mRNA. It's a piece of genetic code that is a template on which our organism, our cells, build proteins. It's a bit like a piece of a software based on which the cells produce proteins. And in this case, it's the S protein, the spike protein, one of the key proteins of the coronavirus that we fight now. And basically what these vaccines, mRNA vaccines do is that they make our cells produce their own vaccine. They make the cells to produce S protein. and then the organism can learn how to fight it. It was the first or one of the first platforms to be used for COVID because it was easier to design a vaccine using this technology.
How is that different from previous vaccines? So like measles, for example, something that many people get quite young as a vaccine. So what is different? So is the COVID vaccine something that is completely different from other vaccines, or is it relatively the same based on the same principles?
In terms of COVID vaccines, various platforms are used. So this is just one platform, the mRNA vaccines, but another platform is viral vectors, where genetic code coding the S protein is built into a benign virus that is given to our organism. There are also platforms based on just the S protein that is injected, and others that are more classical, like the whole inactivated virus. So a number of platforms are used, and this is a very good thing because we need billions of doses really to protect people from COVID disease, and especially severe COVID disease.
So this mRNA technology, is it relatively new, or has it been around for a long time?
It's not new because the work has been going on it for years, but in 2020 it was used to design one of the first COVID vaccines. But the work has been going on, so to be ready at the beginning of 2020, of course, there had to be years of development, and these vaccines, the concept vaccines were developed using this platform for rabies, influenza, even cancer, some types of cancer. So there has been some history of development of this platform.
Can this technology be used to work on vaccines for diseases that we couldn't successfully fight until now?
Yes, and as I said, there were some other diseases that were targeted with these vaccines, and the work is continuing. And the good thing is that this platform can be used for a new emerging disease. This might not be, unfortunately, the last pandemic, and this platform allows for a relatively fast design of a new vaccine. Whenever the genetic sequence of the new emerging pathogen is known, a new vaccine can be produced using this platform. So it's quite flexible, and it will allow to confront other threats in the future.
But with this technology, does it mean that the previous technology, the previous methods of creating vaccines will become redundant?
I don't think so. The bacteria and viruses, infectious threats, they are of different nature. They need some different stimulation of different parts of our immune system. So I think we will continue to need other platforms, the more classical platforms and the modern platforms. And for some diseases like COVID, we need so many doses that we need to apply several platforms for vaccine production.
Okay, so throughout history, we've only seen one disease completely eradicated by vaccines so far, and with polio also nearly eradicated. What needs to happen from a community perspective in order to begin to eradicate more diseases like that? What can we do in order to see more diseases go the same way?
That's right, that the only infectious disease eradicated so far is smallpox, and communities around the world played an important role in this eradication. But it's not only the communities that play a role here, and there are also characteristics of the virus itself that are very important, and there are some criteria which make a disease prone for eradication. And one of them is, for example, that it should be primarily a human disease. There shouldn't be animal reservoirs. Another characteristic is that optimally such a disease should have very distinct clinical symptoms, and so it's easy to recognize and identify. And also the duration of immunity against this disease should be long-lasting. And for COVID, when you think about it, these criteria are really not met because SARS coronavirus 2 can infect animals. We heard about mink farm outbreaks. It can infect companion animals, etc. So it will be quite difficult from that perspective to eradicate it. Also, the symptoms are quite non-specific. These are the symptoms of respiratory infections. And we don't know yet how long-lasting the immunity really is, which means that eradication is not a primary goal here. We have to focus on reducing the transmission and protecting the vulnerable.
Okay, so more generally, when we're talking about what we do here, what is ECD's role when it comes to vaccine and vaccine scheduling in Europe?
We have a whole disease program on vaccine-preventable diseases and immunization led by Lucia Pastore-Celentano. And the program does many things, but I'll just mention a few. One important thing is that the program collects information on the epidemiology of vaccine-preventable diseases, what we call surveillance. So it monitors what is the burden of these diseases and where it focuses, in which areas or populations, because you need to know where the enemy is to target our work, our approach. Another, and here we base this on the data that we collect from the member states. Another thing that we do in the program is issuing scientific advice, especially on new vaccines that are becoming available. And here we usually outline, based on evidence review, we outline pros and cons of these vaccines and we outline options for how they can be deployed. And it's then up to the member states to really choose the right option based on their local situation. They know their local context the best and they can choose the right option. And we don't work in a vacuum. There are not so many of us in ECDC. So we have to rely very much on the experts from the member states. So we do a lot of work from networking. And an example of this can be the network of or a collaboration of National Advisory Committee on Immunization. In every country in the European Union, there is a committee, expert committee, advising how to design the vaccination program. And we provide a platform for collaboration of these committees and also a secretariat. And this has proven to be very useful during COVID, pandemic, where countries were able to exchange experiences, plans, and discuss their approaches with each other.
But how does ECDC work with the European Medicines Agency, EMA, when it comes to vaccines and rollout? You mentioned this sort of cooperation between many different agencies in the member states. So with a sister agency like EMA, how close is the relationship?
So I spoke a little about our work that we do in the area of vaccination and immunization. And the role of the European Medicines Agency is one of the primary roles is to develop scientific opinions on the new vaccines. And these opinions are used by the European Commission to authorize the vaccines, to license them. And we collaborate very closely with the European Medicines Agency in the monitoring of what happens next when a vaccine gets authorized and is being used. The monitoring that the European Medicines Agency does focuses more on the safety of a new vaccine, and ECDC monitors usually more of the effectiveness of the vaccine and the impact of the vaccine on disease. And we collaborate very closely on this monitoring.
Okay, so how unprecedented has the rollout of the COVID-19 vaccines been? Obviously, with more than 500 million doses given in Europe so far, did you ever think an operation on this scale would be necessary or even achieved in such a short space of time?
This is really impressive and unprecedented. The whole world wondered how the vaccines could be deployed in a short time, and we knew that this would be one of the biggest public health operations in the history of public health globally. And through the concerted effort of many actors, billions of doses have been deployed already globally. We know that in the EU, indeed, more than 500 million doses have been deployed, and more than 60% of the population got the full course of vaccination. But when we look globally at the situation, there only 20% on average of the population got 2 doses or completed the primary series of vaccination. And this is concerning. So there is still a lot to do because we can only be safe when everybody is safe. And I would like to encourage everyone who actually gets an offer to be vaccinated to accept it.
Okay, so that's actually leads very nicely on to my next question about the importance of having large numbers of people vaccinated, because we've been hearing a lot in the news recently about vaccine breakthroughs. What are vaccine breakthroughs?
Vaccine breakthrough infections are infections that happen in people who got vaccinated. And I'm getting this question often in individual conversations with non-experts. How come people who are vaccinated can still be infected? Well, no vaccine is against COVID is 100% effective. That's one fact. And another fact is that they were not designed really to prevent infection. They were primarily designed to prevent disease. and especially severe disease, because this is what we worry about mostly in terms of COVID. COVID can infect people and cause even an asymptomatic infection where people don't have any symptoms. But in a fraction of people, it causes severe disease that may kill people. So this is what the vaccines are supposed to prevent. So it's not unexpected that some people may be infected even though they were vaccinated. But I want to emphasize that the risk of being infected is much lower in people who are vaccinated than in those who are not vaccinated. And especially the risk of having disease, and especially the severe disease, is much lower. So that's why I would like to, again, encourage everyone who gets an offer to be vaccinated to really accept it. This is the way to protect ourselves from the COVID disease and potentially severe disease. It's also a way of protecting the others because vaccines decrease the risk of being infected. So we are protecting the others who may not be able to be vaccinated or who may not react with strong immunity to the vaccine. So it's a matter of solidarity. And also, when a wave of COVID hits a region or a country, I know what happens in healthcare settings because I talk to my colleagues with whom I worked in a hospital. It's really putting a lot of pressure on the healthcare system and especially on healthcare workers. They really get extremely tired. And also, the hospitals are filled with COVID patients and people who have non-COVID urgent diseases that need to be treated. They may have difficulties accessing the healthcare facilities. So by getting vaccinated, we prevent this, give some breathing space to healthcare workers and allow them to rest and treat other diseases. So that's why it's very important from different points of view to really get vaccinated.
Moving away very briefly from COVID, when it comes to other diseases that we normally get, whether it's as children or teenagers, is there some concern that other vaccines are being missed, such as measles or mumps and rubella?
Yes, there are sometimes missed opportunities for vaccination in regular times before COVID, and the public health authorities always encourage the healthcare workers to use every opportunity to offer vaccination, to increase the vaccination coverage. And this is very important because we don't see many cases of infectious diseases that caused huge epidemics in the past because of high vaccination coverage. But when this coverage goes down, we may see again big outbreaks, and sometimes we see them in areas where vaccination coverage decreases. So the threat is there, and it's very important to keep the vaccination coverage high. There was a period last year when there were problems with functioning of some healthcare systems, and this increased these missed opportunities to get vaccinated against other diseases. And now in many healthcare systems, there are attempts to catch up with this.
And this is something I take it ECDC is continuing to monitor closely.
Yes, we monitor this together with the World Health Organization.
Well, that's all the questions I have for you today, Piotr. Thank you very much for your time, and hopefully we'll speak to you again soon.
Thank you very much.
We hope you enjoyed this insight into the work that ECDC does with vaccines and understand their importance in wider society. If you would like to know more about vaccine schedules for a range of diseases, you can find more information on vaccine-schedule.ecdc.europa.eu. There will be a link in the notes for today's episode. For more general information on the work of ECDC, please visit us on the web at ecdc.europa.eu or follow us on social media for the latest news.